My name is Sean Fader.
Laura Fader.
I'm Kendra.
Kendra is an identical twin. She was born 3 months premature. She's here today to have her jejunectomy reversed. That's a feeding tube she had in her intestines. She was tube fed for the first few years of her life after she was in NICU. She just turned 4. This is actually her 14th surgery. This is a lot harder, this one. She hasn't had a major surgery like this in about a year, so she certainly knows a lot more what's going on now. And so we've been talking about it in the family, but it is harder to hear her vocalizing about how she's feeling and being nervous.
Well, my name is Allison Gray. I'm a pediatric anesthesiologist at the IWK, and I'm also the president of the medical staff. The anesthesia machines, we have 19 at the moment, 5 on the women's obstetrical and gynae side, and the remainder are in the pediatric side with 1 down in the diagnostic imaging unit. They're used for all surgeries where the patient has to go to sleep, and we also use them in diagnostic imaging. We use them for patients who need to have sedation or anesthesia for their CAT scan or for a nuclear medicine scan, or most often for the MRI unit because they have to stay very still. They're used every day. All of them pretty much are in use. We have 2 that we keep as backup so that we can cycle them for servicing and repairs.
Last night at the supper table, she, out of the blue, said to Kinsey, will you worry about me tomorrow? And then she said, remember, I'll always love you. And Kinsey said, I love you too. A little hard for us to hear because we know she knows what's going on as well.
Anesthesia machines are designed to do 2 things. One is to deliver the anesthetic agents to the patient, so that's the gases, and they can deliver oxygen and nitrous oxide or air as we need it. They also ventilate the patient if we have to assist them with their breathing. In addition to that, we monitor every aspect of the patient's physiology while they're asleep. So we keep an eye on their heartbeat. We monitor the amount of oxygen that they're getting to make sure that we're delivering it correctly. We also monitor their breathing so that we know, 1, that they are, and 2, that we're breathing well for them. And we also monitor their blood pressure.
Other parts of the hospital, you always get to be with your child, but in surgery, you have to say goodbye to your child at one point, and it's completely, your child's in the hands of other people, and there's a lot of trust there as parents and the machinery, the type of care they're getting.
All the machines in the hospital came at the same time. They are now coming up to their 12th year. Basically, if these were your car, these essentially all have about 400,000 kilometers on them. They're very well used, and they are serviced on a regular basis to maintain them, but they're essentially coming to the end of their lifespan.
What would happen if one of these machines gave out, God forbid, during a procedure?
Basically, the first thing that we do is that we take over breathing for the patient, manually ventilate them. We deliver the anesthetic agents through the IV and make sure that the patient is safe, and we have portable monitors to put them on, and then we switch out the machine that has failed and bring in the backup unit. We're very compulsive about checking the machines because we rely on these so much to do what we do.
The staff here is great, and they make every effort to treat the kids like they're their own. One of their NICU primary nurses, Dawn Holland McKinnon, she's in NICU today, but she works in the OR sometimes, and she's actually coming over today to take Kendra in the OR, so it'll be more comforting for her for sure.
We're gonna go down this way.
See you later, Kendra.
Between the 2 kids, there's been 16 surgeries. We've had to say bye to them and send them off, so yeah.
She was smiling on the way out, so we're crying too.
Well, it helps when somebody she knows is taking her back, so it makes us feel better too.
It's a waiting game now.
The new machines are fully electronic, whereas these ones have mechanical parts in them. They also have other means of ventilating the patients, so they have additional things to help support breathing. They have better integration of the monitoring, so everything is all fed back so that we minimize how much gas we're delivering, so that we're delivering exactly the right amount and not too much, or not too little either. So what we've done is given her the medication through the IV to go off to sleep. And so we just talked to her about what she liked to watch on TV. Then we got her to pick out a dream and what she was going to dream about. And so she told us all about that. And then she was asleep. And she was connected to the anesthesia machine. She has a tube in for breathing. And right now she's getting her medication to stay asleep from the anesthesia machine, and the machine is breathing for her, and we're monitoring her. Most of the surgeries would not occur without these machines. So essentially they are fundamental to the functioning of any operating room suite. months, they've started the surgery, finding their way through the old scars. You can see how important the anesthesia machines are for doing this. It wouldn't be possible without it.
The surgery went really well. They were able to do it more simply than what we originally were thinking was going to be happening, so they didn't have to open her belly up as much, so that should make a big difference in recovery time. She's happy to see Mom and Dad now, and we'll just snuggle with her a little bit in recovery before we go upstairs. Hopefully surgery number 14 will be the lucky one, and we won't have any more after this. She still has her G-tube in her stomach, but that can be removed without surgery, and the stomach just closes up, so we're hoping she'll have no more surgeries after this.
As we have fewer and fewer machines, we are starting to look at the potential risk, if we don't replace them, of having to close operating rooms because we don't have the anesthesia machine to deliver the anesthetics. And so it's of significant importance to the hospital that these are replaced.
Now's the time.
Now is the time, basically, yes.
Please support the IWK Radiothon on C100, 1-800-595-2266 or C100FM.com.